into tiger country. I'd rather not get into tiger country anytime soon. So lift your arm up for a sec. Wow, so they're very irritated. Feel that, Paul. You see this one? Very soft.
Yeah, that feels just like a breast tissue.
This one's a lot bigger. This one is a little scary. Huge. This is called ectopic axillary tissue. It's essentially enlarged breasts at the tail of the breast tissue. Every girl has breasts and then a small tail that leads into the armpit.
Okay.
Rarely during pregnancy, it can enlarge temporarily, and then it almost always resolves after that. For some reason, yours persisted.
Right.
I've never seen this big a persistence. Let me tell you what's complicated about your case.
Yes.
The armpit is what we call tiger country. Tiger country is an expression we use in surgery that means if you dissect in an area, there are things you can see and things you cannot see. For example, there's the lymphatics, the lymph nodes, and those are microscopic. You can't really see them, and if you get into them and you disrupt them, it can lead to a chronic, potentially debilitating problem. Your right ectopic breast tissue, and that's why I was feeling it, goes way into tiger country. I'd rather not get into tiger country anytime soon. Most of the time, ectopic breast tissue is primarily fat.
Right.
So you could put a liposuction cannula in there and suction probably 85% of it. That's a way of minimizing the risk. You might still have persistent breast tissue in there though, because you can't suction out breast gland tissue. And whatever's left, we open it up and try to do dissection and get out as much as possible without getting into tiger country.
Right.
All right?
Yep.
Good plan?
Yep.
Sounds great.
Thank you so much.
Great to see you guys. Let's do this thing.
Before my surgery, I had 4 breasts and 2 of them were in my armpit. They made me insecure and they rubbed raw. But now, thanks to Dr. Dubrow, my armpits look normal again. There's no more chafing, no more embarrassment. I can finally wear the wedding dress of my dreams without worrying about what my underarms look like.
You know, you were a girl with very full breasts, and sort of this is your envelope. So ultimately, the mound was all the way down here, right? They put this big implant in, but this is on the abdomen. Who has a breast down here? But they were trying to accommodate the deflational change by putting a large implant, and they were faced with a pre-existing little bit naturally lowered areola. You can't just move the areola, so they lowered the mound.
I see.
And nature will only let you lower the mound so much before you get into what I call double bubbleville.
Yeah.
A double bubble is when you lower the breast crease on a patient to make room to put an implant in. But if you lower it too far, you have 2 creases. One, the original inframemory crease, and the new one you created when you lowered it. I still can't wrap my brain around as to why it failed. Was it because it was thin skin and it kept dropping? Was it double bubbling because they lowered the crease too much? The question as to why Jody's breast operations kept failing, it's most likely related to a number of factors, not the least of which is her own soft tissue weakness and the inability to tolerate a large implant. That's why any plan that I may formulate must include a smaller implant to maximize the amount of soft tissue coverage and minimize the weight of the implant on the surrounding tissue itself. You have a very short distance between the areola and that non-existent lower pole crease.
Right.
So how do we get an implant in there and not have the areola live in the bottom part of the mound? I think there's only one possible plan, and that is we make an incision, we open up the pocket very gently, we put an implant in that the pocket dictates. So we go full enough to give you nice volume, but not so full as to make it a tight closure or putting much internal pressure on the breast tissue.
Right.
Jody, your case has a very high probability of failure.
Right.
I think it's probably less than 50% chance of success.
Yeah.
You want to do this thing?
Yeah.
Before my surgery, I was completely stripped of my breasts. I was left with nothing but skin and really bad scars. But now, thanks to Dr. Dubrow, I finally have breasts. They're the perfect size, my scars are minimized. Now I even feel sexy when I'm in my uniform. I feel like a woman. My breasts are amazing. It's not perfect, but no more level 4 disaster here. My breasts are looking great.
So this left one, oh wow, it goes halfway up your back.
Yeah.
Never seen one move up. We've seen them flip, we've seen them go into the hips, we've seen them go too far down, but never really seen that. Huh. So he tried to fix some lower portion droopiness by doing a gluteal lift. This guy's a gutsy guy, man. Normally, buttock augmentation procedures are focused on the upper half of the buttock. Only in very rare circumstances do you do surgical procedures in the lower portion because it's very difficult to keep the normal anatomic contour there. And you have to really know what you're doing before you make an incision in an area where the buttock meets the leg, and you might be able to see it when they bend over or wear a bathing suit. First and foremost, you have pain and discomfort. Taking the implant out should fix that. But by taking the implants out, immediately you lose all projection.
We can't take fat out these thighs or these arms.
The problem is you have this giant pocket. You can't just throw fat into a pocket. There's no place for it to get any blood supply. So how do we get tightening of the skin? Well, we can probably do a buttock lift. You already have a scar there. I can probably help some of the laxity in the lower portion where the gluteal fold is because you already have a scar there.
Right.
See whether you have some fat that maybe I can rotate down and do the best we can, knowing that it may be really disappointing.
This is the conversation I've been fearing all along, but I'm very hopeful that Dr. Dubrow has lots of magic tricks up his sleeve. But I still want some biscuits. You know? Well, I'm hoping I won't have a pancake, just some biscuits.
Okay.
Before my surgery, my friends called my butt the Dunkum because it looked like an uneven pair of giant basketballs. I had 2 butt implants that were causing me a lot of pain. I had a dent in my lower left butt cheek. My quality of life had just been taken from me. But now, thanks to Dr. Dubrow, I have a naturally projecting butt that is symmetrical. And the pain and the dent are so gone. Dr. Dubrow is the Dunkum MVP of surgery.
This one, it's soft and it's
boy.
distinct from the rib too. This one looks bigger.
This one is bigger.
Than this one. So when you're lying down sometimes it probably goes right over, and that's when it hurts?
Yeah.
These masses feel like balls of fat. I've never seen anything like this before.
There's this phenomenon when it comes to fat. You can, instead of doing liposuction, you can put these freezing devices on. It's called cryolipolysis. It kills the fat through freezing it, and then it dies, and then you urinate it out. But 3 to as much as 10% chance that instead of it dissolving the fat, it causes the fat to grow up.
more.
Yes. I don't have one of these freezing machines, but I have seen this dozens of times. My theory is that all of the trauma that Bruno's chest has sustained from that surfing has caused the masses in his chest. Usually, you would think it would cause atrophy or a reduction in fat in that area. But in his case, it's caused a more rare form of paradoxical increase in the amount of tissue, which is very unusual, but very interesting. Now, what's confusing though, is that if I am right, and it's paradoxical fatty hyperplasia, the liposuction should have worked.
No change, that's the weird part.
Very weird. So we have our differential diagnosis of, and I think it's paradoxical fatty hyperplasia. I think most doctors, like Dr. Nassif, would think it's a lipoma. I think that's second on the list. And then there's a third oma that's possible called a fascinoma, where we don't know what it is, but it's totally fascinating. Either way, it has to be operated on to remove it. We do a tummy tuck. You make an incision, lift it up, take the whole thing out, and pull down the excess skin. And in your case, the advantage of that is that all of this would be gone. The skin would be all tight.
I never imagined I would get a tummy tuck. I am very excited now. I'm gonna get some breast implants and pointy ears. Before my surgery, I had 2 huge masses on my chest, but now, thanks to Dr. Dubrow, the masses have been removed, the pain is gone, and I can now enjoy the sport I love. Dr. Dubrow and Dr. Nassif, they changed my life for the better. I cannot thank them enough.